Okay. I think I'm going to stop presenting my screen. What I want you guys to do is, if you change your setting on your computer on your Meet so that it's, I think it's like personal view, or what is it, speaker view or something like that. You should be able to see it a little bit better. So try and make it as big as you possibly can. Is it speaker view? I think it's speaker view. Oh, wow. That was a good shot. You guys just saw my AirPod go straight into the pig bin. Nice. I have it on camera too. Okay. Can you still hear me okay with the one end?
Yeah, we can.
Okay, cool. Yeah, that sucks.
Did you get it out?
I just took it out, but it's still a little
Yeah, I wouldn't put it back in.
I'm gonna just get a disinfecting wipe and put it on top of there. That's fun. You know, it's better than, I almost lost it in a pig bucket last quarter, so this is preferable to that for sure. But I don't know where any of our wipes are, so. Yeah, you won't be able to see the trachea really till we cut into the thoracic cavity. Yeah, that's okay. I'm just gonna get a little bit of a sanitized environment here for my little AirPod. Okay, there we go. We'll deal with that later. Okay, sorry about that, everyone. Thanks for your patience on that one. Did you guys see it flying down into there? No, small intestine smaller in diameter. Longer in length, yeah. Okay. So right now I am cutting down into the abdominal cavity. We're going to be looking at the digestive system today. And I'm putting my finger in here so that I don't cut through any organs that I don't want to. So if you stick your finger down in here, you can kind of pull the skin away. So I'm trying my best to do that. And right now what I'm also feeling for with my finger is the diaphragm. So the diaphragm separates the abdominal cavity from which cavity? What's this one up here? Oh, or did you, you might, so, yeah, you're fine. I realized, you're fine. You're fine. Okay. I know my hand's kind of in the way right now. Right now I'm trying to cut around the umbilical cord and down on either side because there's actually an organ on the underside of the umbilical cord that we don't want to damage, which we'll see in a little bit. All right. So I'm going to feel for the diaphragm. Which cavity is that separating? The abdominal from, which one is up here that has your heart and lungs in it? Anyone remember?
Thoracic?
Good, thoracic. That's the thoracic cavity. So right now we're just cutting into the abdominal. And we'll see the super awesomely cool diaphragm in just a little bit here. But I'm going to cut down on either side of the abdominal cavity, exposing the digestive organs. Again, trying to preserve the, there we go. Preserve the diaphragm as best as I can. All right, so I'll do a little bit of an exposure here. So let's see what organs we can kind of already identify. So if you look at your formative, it kind of walks you through what we're going to be seeing. And we're going to be seeing most of the organs that are in the digestive system, because most of those are in the abdominal cavity. The esophagus is obviously running down behind the heart and lungs, so we're not going to see that until we cut into the thoracic cavity in a few days. But here we go. So what organs do you guys think we're going to be seeing in the abdominal cavity? What digestive organs?
The intestines.
Yeah, we'll be seeing the intestines, absolutely. What else? What else is in that cavity other than the intestines?
Would you see the diaphragm as well?
Well, the diaphragm is separating the abdominal cavity from the thoracic cavity. And that's kind of more of a breathing organ, right? Because it's what's controlling the size of your lungs and determining like how much air we can breathe in because of that volume change. But it is important in kind of separating the abdominal cavity, where all the digestive organs are, from the thoracic cavity.
What about the like umbilical vein there going right under the diaphragm?
Yes. Oh, Bella, I love that you just said that. What about the umbilical vein? Yeah, so this right here is the umbilical vein. So this is what is bringing blood, well, let's see. So if it's a vein, it's bringing blood towards the pig's heart, right? So this is actually carrying oxygenated blood from the placenta through the umbilical cord, and then up through here, eventually to go up to the pig's heart. And we have to cut through this in order for us to pull down the umbilical cord and the organs that are underneath that. But there, right there is our umbilical vein. And you know what I'm going to do for you guys is go ahead and snap a picture before I cut through that, okay? And then I can share that with you. Okay. You can do the brain. It's gonna be optional if you want on the last day. Yeah. The stomach is under the liver. Yes. Yes. There's a prompt. Yeah, so you'll start to, so I want you to kind of cut, like find the stomach and then cut like almost right where the stomach is kind of encountering the diaphragm, because right there, yeah. So like just kind of cut through, if you want to come look in a second, I can show you. I just cut through the umbilical vein. Now I'm cutting down on either side of the umbilical cord. And then the organ that's underneath here, does anyone know what organ? I know it's a little hard to see, but there's an organ right here, right underneath the umbilical cord. Does anyone have a guess as to what that is? If you're not sure, it's okay, because we're not there yet. But that is the bladder. The bladder is actually right down here. But we'll talk more about that next week. For now, we're focusing on digestive. Yes, that's the umbilical vein, and you're going to need to cut through that in order to expose the whole abdominal cavity. All right, so here is our abdominal cavity, all of our organs inside. Any guesses as to what this organ here is? It is quite large. It's sitting ventral to the stomach. It's also anterior to the stomach in the pig.
I want to say the liver.
That is correct, Ella. It's the liver. So this right here is the liver. And something kind of interesting is, remember how we talked about the pigs have been injected with this latex, this dyed latex? You can see these blue spots in the liver. Because remember, we talked a little bit last week, what's the liver's like job? What is the liver doing, amongst other things? Or what's it do with blood?
Like processes it, like cleans it basically.
Yeah, exactly. It kind of like detoxifies and cleans our blood. And so we've got this, we've got a lot of blood in the liver basically. And so that's kind of what we can see here with all these spots from that injected dye. That's what that's from. Now, if I were to, oh, actually here, well, before I dive in, what do you guys think this right here all is?
Intestines?
Yeah, that's the small intestine. So the pig's small intestine is all of this right here. And we'll take this out in a little bit and look at kind of how long that is. Pigs and humans have very similar structures. The one difference is between the pig and the human's large intestine. So in a human, as you saw on the digestive system work you guys have been doing, the human large colon goes like right kind of around the small intestine, and we have like an ascending colon, transverse, and then descending colon. In the pig, we have like this kind of big just glob over here, and this is all connected to that tissue that we're going to be talking about in just a second that's holding it all together. But it looks a little bit different than does the human large intestine. So ours actually does look like it does in all those pictures where it goes up, across, and then down. Okay. So we've got all of our intestines down here. Here's the liver. And then if we were to kind of look underneath the liver, if I lift the liver up a little bit, I know it's probably a little hard for you guys to see from that angle, but what organ is going to be, let's see, on the pig, it's going to be a little bit posterior and then slightly dorsal from the liver. What do you guys think? What digestive organ is here?
Is it the gallbladder?
Ooh, good guess. The gallbladder is also here. And I can show you the gallbladder in a little bit. The gallbladder is a little bit smaller though than this particular organ is. And this particular organ is one we talked about a lot at the beginning of class. We don't actually need it to live, but it is very crucial in a lot of the initial digestion of the food that we eat.
The stomach?
Yes, the stomach, good. Yeah, so the stomach is right back here. I'm going to cut it out so you'll be able to see it a little bit better, okay? So before I cut all of this out and we start to kind of look at what we have all in here, does anyone have any questions? Okay. So I am going to start working on cutting out. Yeah, you should cut through the umbilical vein. Yeah. Asher, can you do me a big favor and grab me some paper towels from the dispenser back there? Thank you. I'm gonna make sure I have a place to put it once I cut it out. Okay, I know it's hard to see because of my hand being in the way. But right now what I'm doing is trying to cut through up near where the esophagus meets the stomach. Perfect, you can just set them right here. You can just set them on the table. Thank you very much. It's left. Okay, so I'm gonna cut through. It's kind of connected to the liver a little bit with its tissue. Once it comes out, you'll be able to see a lot more, I promise. Oh, here we go. Here it comes. Come here, stomach. I know you wanna. Because I can't even begin to express to you how hilarious it is that I got on video my AirPod just flying into the bucket. I'm gonna send that to Mr. Youngquist and be like, thanks for the AirPods. Okay, so right now I am having to cut away at some of the tissues that are holding the intestines in place. So when you guys watch movies, like horror movies especially, and like someone gets stabbed in the stomach, or like, they're trying to like, if something happens to the abdominal cavity. Have you guys ever seen in a movie like a bunch of like intestines just like fall out like it's spaghetti? Have you guys seen that?
Mm-hmm.
Yeah, so that's definitely not how that works. So our intestines are all very secure inside the abdominal cavity, and as you can tell, I'm having to do quite a bit of kind of tearing away at tissue in order to get it out. So that definitely wouldn't happen if you got stabbed in the stomach. Your intestines wouldn't just like start falling out like loose spaghetti. Okay, we're almost through. I'm having to sever some stuff. I already cut through the large intestine. I know it's hard to see. It'll be a lot easier once I take this out of the pig, which we are getting close to here. Ooh, I see some good arteries back here. I might have just cut through the aorta on accident. Whoopsie. Kind of. You're gonna laugh, but I need to actually drain my pig a little bit. Get some of the liquid out. There we go. So I can see a little bit better. Hopefully you can see a little bit better too. So yeah, like I said, very connected in here. All these tissues are do a very good job of keeping all of this in our abdominal cavity. If any of you are confused on like what you need to do next, you're welcome to come look at what I'm doing. I'm cutting out my intestinal and still most of the digestive tract. And there, I also have a bit of a advantage that I've done this many times. Okay, there we go.
Okay.
So here we have all the way from the stomach through this is the stomach right here. Yep, all the way through the small intestine, which are these kind of smaller, I really hate to say it, they kind of look like noodles. And then we've got our large intestine right here. You're never eating noodles again. So to pull this out, to cut it out, you kind of need to pull up on the intestines and on the stomach, and then cut like underneath as best you can. Yeah, you might need to tip it over and let the juice out. Hi, Nurse Emily.
Miss Whitney,
Yes.
this might be a weird question, but just looking at it, I just know what it smells like. Does it have a smell?
It does have a smell. Oh, sorry, Nurse Emily, hold on 1 second. It does have a smell, but it is it's more from the preserving molecules than anything else.
Oh, okay.
However, once I cut through the large, you can kind of see here, if you look down, you can see the very ends of the large intestine.
Mm-hmm.
And then there's like some stuff coming out that is actually like fecal matter from the fetal pig. So that does have a little bit of a smell, but the bigger smell is the chemicals that preserve everything.
Oh, okay.
There's the umbilical cord, and then that's its bladder. Yeah, they were like within a couple weeks of being born, maybe even like a couple days potentially. Yeah. Nurse Emily stopped by to bring us more paper towels. You're welcome to stay as long as you want to. Hi, Madison, you just checking it out? Yeah, so you kind of like lift up on everything and then just kind of cut away as best you can all the tissue underneath. Okay. Yeah. Okay. Yeah, you're welcome. All right, so I'm gonna scooch our pig out of the way. We can pull its liver out a little bit later, and then we'll look at what's on the dorsal side in here of the abdominal cavity. We'll look at that later. But for now, we're gonna kind of focus on the intestinal tract. Does that sound like a plan?
Yeah.
Okay. That's okay. That's fine. That's totally fine. We go through them, so those are perfectly fine. All right, I'm gonna scooch our pig over here next to my AirPod. Okay, here we go. Here is our intestinal tract. Okay. So we're going to start kind of at the beginning of what we have in there, and then we're going to work our way through. And I'm going to spend a little bit of time like trying to tear through some of the mesentery here, which is something we'll talk about in a second. So this big sac right here is the stomach. Okay. So the stomach is right here. This is where, like we were mentioning at the beginning of class, a lot of the chemical digestion starts to happen. What's in your stomach that, I mean, there's multiple things, but what's one thing that's in your stomach that helps to break down your food? It's, so just kind of like pull it and lift up as best you can, and then like just like start lightly like tearing at the tissue underneath. It's okay. If you cut through it, it's not the end of the world. Nice. Any guesses? What's in our stomach that helps us start to digest our food?
Is it pepsin?
There is pepsin, yes. So pepsin is in there. That's starting to break down proteins. Very good. It is normal for poop to come out of the intestine. There's also hydrochloric acid in your stomachs. That does a lot of work with killing bacteria. It also starts to digest a lot of the food that you eat as well, to kind of break things down. All right, so I'm gonna start cutting through all this tissue. So you can kind of see it almost looks like kind of clear. You guys see how you can see my glove through that? It's really thin. But this right here is called mesentery. So this mesentery is this tissue that's just kind of surrounding and keeping all of the organs together. But there's something very important that is running through the mesentery. Here's our pig's spleen. I accidentally cut that out. Cut through a lot of arteries and veins here. But it's easy to do. I'm going to start tearing away the mesentery and the small intestine. So you guys see here, and I'm going to take a picture of this and get a good picture of that, but try and bring it as close as I can. You can see how like my glove is there in the background, but then you see these little like lines that are going out from the mesentery toward, like through the mesentery towards the small intestine. What do you guys think those are? Do you know what the role of the small intestines is? These little lines going out. Any guesses? Let me get a good shot of that. Any guesses? What is the role of our small intestine? What do our small intestines do? You guys want to take a little break? You guys are very quiet right now. Yeah, there's paper towels up here or back there. Feel free to grab some. I'm going to start unwinding. Yeah. I'm not going to finish mine today because I got to do some rounds. But I don't know how easy this is to see. I started off by cutting through the mesentery, which is this tissue here. It's like thin tissue, yeah, that's kind of holding it in place. And then also, we figured out, what do we think these little lines are? Can you guys see the lines I'm talking about? They're like,
The ones that look like little veins a little bit.
yes, that's exactly what they are. They're little arteries and little veins. So they're blood vessels that are bringing blood to the intestines and then taking blood away from the intestines. Why would we need to have blood going towards and then away from the intestines? Think about what the purpose of our intestines is.
Well, don't our intestines like our food? It digests our food.
Yes, so it digests because it's breaking down. And then towards the end of the intestines, after the food has been broken down into simpler molecules, what needs to happen to it? Remember that the inside of the digestive tract is technically outside of the body. So what are these little, like, and think about what we learned about with blood vessels, like little capillaries, even in the respiratory system. Like, why might we need to have blood going towards and away from the digestive tract?
Is it like moving nutrients and stuff that's coming from the food?
Yes, exactly. So it's absorbing the nutrients. So it's moving nutrients from the digestive tract into different parts of the body, depending on what those nutrients are going to be needed for. Exactly. So I just kind of started cutting through that mesentery. You can see here, like this is just a tiny part of the small intestine. And you can imagine, like, if this is the small intestine of a fetal pig, imagine what our small intestines are like, right? Very, 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 very long. And we'll cut in to a part of that in just a little bit to see, in the stomach especially, to see what it looks like. Can you cut the many tiny things from anywhere? You can start cutting anywhere, and then it'll kind of start to, like, yeah, it'll start to unfold a little bit. Good. Okay, so I'm gonna stop here, but I will get a picture. I'm gonna like keep unraveling this later on in the day. And then I will get a picture of that up on the drive. And I'll also, if you guys want, I can also record that video and share that with you guys if you'd like. So it won't be as awesome because the AirPod won't be going directly. You should try to do yours. It's a good time. So I started off by kind of just pulling, I'll be coming around in a second actually. Okay, remote students, I am going to go touch base with some in-person students on a few things, okay? I'll be back in a little bit. For now, you guys can be working, if you haven't started uploading photos from day one into the dissection formative, you can start doing that. You can also be working on the digestive system formative, and then soon I will assign the reproductive one so you guys can start working on that. So I'll leave this here. You can admire the abdominal digestive tract. I am going to go touch base with a few students and I'll be back, okay? You guys can also go take a break because I realize you haven't done that yet and you haven't really been moving around. So feel free to go move around if you need to. I'll be back in a little bit.